Good afternoon. Wanted to provide an update on what's going on with the state of Florida, particularly with our reopening, as well as with the COVID-19 response. I think that we will see, hopefully by the end of the week, with the jobs numbers. I know they put out an interim report nationwide, and hopefully that positivity will be reflected in Florida's report. There was a lot of uncertainty when we went down this road, had never really seen a nationwide shutdown like this before, and I think the question is how you bouncing back. Is it going to be more of a V, or is it going to kind of be a long slog in a deep recession? We're hoping that the bounce back is quick, doing everything we can to do that. Now, even if it is quick, I think we all know that the budget picture is a little bit different than when the legislature was working on this through most of January and February. So I've been going through different things on that, and we'll obviously be doing something by the end of the month. But I think everyone can expect to see a little more red this year than they did last year, and that's probably what we need to do in terms of fiscal prudence. So I wanted to provide an update on what Florida's been doing in terms of testing, some of the results that we've been seeing, and then what we'll continue to be doing going forward. One of the ways to think about what's changed is when this pandemic started, the testing was basically diagnostic. Somebody would show up with symptoms, and then if they even if they were a certain age, they wouldn't do it. They had to be old enough. You'd get tested, and then if you were positive, then there would be whatever clinical results would flow from that. Now, with increased testing, it's really moved towards more of a surveillance style, just in the sense of there's people that have no symptoms at all that get tested by the thousands every single day. And with an illness where most of the infections are either asymptomatic or mildly symptomatic, that's something that's very, very significant. And back in April, you remember when we started doing our phase one, I made the point that as you test more, you will see more cases because you're identifying those subclinical cases that just would not have been tested previously. And I said that, you could see, 2,000 cases a day in a state this big. That was something that was definitely in the offer for this. And it's just because of how you're doing the testing, especially if you're expanding it as aggressively as I thought that you needed to do. And so obviously you look at the day-by-day testing numbers, March, April, sometimes didn't even get 10,000 test results back a lot of those days. As we've gotten into May and then really June, it's been consistently in about the 30,000 test results a day. You look at that one big point on I think it's like the third week of May, just understand what that was Quest and LabCorp, when they were getting backed up, they would report the positives relatively routinely, and then they had massive backlogs of negatives for weeks and weeks. So that was the day they dumped, I think, about 60,000 negative results. So it kind of skews it a little bit. There were not that many tests actually conducted that day. That was built up over several weeks. But I think the trend is clear, particularly, in the last 3 weeks. And you look there, again, that May 17th, 23rd week, because of the data dump, a little bit misleading. That was really stretched out over probably 6 weeks. But if you look, in May, we've been doing probably on average of 150,000 a week. And then now we're close to, we're over 30,000 test results a day in the state of Florida. Look where we were in the middle of March when everyone, I was sitting in the governor's office back then, literally on the phone with hospital CEOs. Hey, what do you need? Okay, I'll send you 200 swabs. And we're directing it at such a small level because the resources were very scarce, and it was obviously a different time. And then here's the total test versus positive cases. The big things, the person's test, the colored is the positive cases. And then you look at the positivity. So for most of the pandemic, we were between 5 and 10%, dropped down to 2% again. That's a little misleading because of the data dump, but we had been in that 3% range, and then now recently 4.9%. And so there's a reason, I think, for that, and we'll show that in a sec. So you're expanding testing, which is important, but you're also going into now, which the state was not doing 2 months ago, into high-risk environments. Well, the long-term care we were, but when you look at like these farm workers and the migrant workers, and we'll show some examples of what that does in terms of when you're in those types of conditions, how this thing can really spread broadly. Now, the cases are almost always subclinical, but nevertheless, there's there. We've been doing prisons, but now you're finding some individual jail outbreaks, which we'll talk about. And then obviously from the second week of April until last Friday, the long-term care has been one of our main priorities. Again, that's in those environments. And our long-term care facilities have done a good job because we have so many of them. But if it gets going, it can definitely spread. And then you do now have widespread testing of asymptomatic people. People are going back to work. You have businesses saying, hey, go get tested. And it's not just the state sites. I mean, we really expanded the drive-through and the walk-up sites, and now we have pop-up sites at retail locations. And that's thousands and thousands and thousands of tests a day. But you have many more thousands on top of what the state's doing. You have the hospitals. If you go into the hospital for something other than COVID, you're still being tested for COVID. Obviously, when you're doing that, asymptomatic people, these are people that most of them don't have it, but some of them do, and then that will show up. So here's an example. This is all within the past week. So there was a migrant worker from Miami that went up to this watermelon farm, was positive with COVID. They figured that out. So then they tested 100 workers at the watermelon farm, and 90 of them tested positive. I don't believe a single one of them had symptoms. Maybe one of them had symptoms. The rest were asymptomatic. And so that's a 90% positivity. And part of the reason is when you have workers like that, they're living in really close confines, sometimes multi-generational, but the real close extended contact in those living conditions is really conducive for having this spread. And then look, 90%. 90 positive cases in one round of testing. I mean, in our drive-through sites, it would take you several days to get 90 positive cases with all the people going through. Probably the whole week you couldn't even get 90 at most of them. So this is really, really significant. But this is basically doing what health departments are supposed to do. You had an industrial factory example, Central Florida. Somebody tested positive. They went and tested and screened 214 employees. 77 employees came back positive. 36% positivity rate in that instance. But again, when you see this, 2 months ago, if somebody was positive, they would have looked to see if anyone had symptoms, and if they didn't, then people just would have gone. So you're identifying a lot of asymptomatic carriers when you're doing the mass testing in these zones. Airport in Central Florida had a couple cases. They did the contact tracing. They looked over almost 500 workers, 260 people working close together, positive, 52% positivity rate on that one. Indiantown, Martin County. If you look at the counties that have 10% or more positivity, it's almost always has agriculture links or prison or jail links. Martin County, I think it's about 10% overall, but that is driven by Indiantown and a lot of the migrant and farm workers. Last week, the DOH and DEM had the mobile lab out there. They did 118 workers. 54 came back positive for 46% positivity rate. And if you look at Indiantown, and the testing there has picked up over the last month or so, they're running at a 30% positivity rate. And again, these are folks who are living in close confines, a lot of people together for extended periods of time, and that provides the good venue for the virus to transmit. Now, in this mobile van, I don't know how many, but there weren't very many who had symptoms out of the 54. So again, most of these are subclinical cases, but these are cases that are being identified. You would not have gone out and brought a mobile test 2 months ago and done these tests. It just that no one was equipped to do that at the time. Jails are also another example of how you can see fast spread. So this is, again, just from the past week or so. 160 staff and inmates tested in Lake County, 100 positive case results, 63% positivity. Again, I think very few of those people, if any, actually exhibited symptoms. Immokalee, that was one of the first places that the DOH and the DEM put in a lot of resources, but Collier County, if you look at Immokalee and then you look at the rest of the 300,000 people, communities, other than that, it's much different. This is high positivity, 23%. That's why Collier has been at about 10% pretty consistently, because as the rest of the county may be testing lower, this one is testing higher. And again, it goes back to the living conditions, the close contact, and really providing areas for the virus to thrive. They're also looking at construction workers and other types of day laborers. They're finding these are overwhelmingly Hispanic workers and day laborers, but they were in Northwest Florida, found a couple cases, contact traced to the households, and out of 15 households, found 53 positive cases out of 15 households. So they're in a situation where you have a lot of people in these households. Once one gets it, that close contact allows it to spread. Again, I think most of those cases are subclinical and no symptoms, but nevertheless, they're being identified that. And I think out of this cohort, they've even found more. So I think it's probably about 74 positive cases from here. And I know that they're still looking at it. And if you look at this demographic, I think they're like 6 times more likely to test positive than the broader community as a whole up in Northwest Florida. And I think that that's traced back to those types of living conditions. The long-term care facilities are also areas where you can have rampant spread. Now, of course, we put in a lot of resources to try to prevent that as much as possible, but if the virus is in and it's left unchecked, particularly in congregate living, you can see it spread very quickly. So we have now in the state of Florida either personally tested with our folks or provided testing for those who can do it themselves to every resident and staff at Florida's long-term care facilities. Now, not every resident has wanted to be tested, not forcing them to do it, but over about a 2-month period between the National Guard strike teams, between our mobile testing bus, test kits that were deployed, and then we did contract with vendors to help support the testing. You've been able to get through that. Now, the residents test positive at a higher rate than the general public. It's been about 8%. The staff has been lower, more in the 3 to 4% range. And if you look, also so that was kind of the first run through on that. And then going forward, we said, okay, what makes the most sense to be able to protect the most vulnerable? And I'll show some data as to why this is the most important things that we can do in terms of saving lives. But going forward, we think it's critical that every person who works at a long-term care facility is tested every 2 weeks. And so ACA has issued that emergency rule. The state is going to provide the testing that they're going to need to be able to do that. But I think it makes sense that if you keep it out of there, then you are keeping the virus out of the most fragile segment of our society. Right now, nationwide, it's probably over 50% of all the COVID-related fatalities have been linked to long-term care facilities. One of the things we've done to try to help with this is we prevented from the very beginning, if someone was COVID positive in the hospital, them being discharged back into nursing homes, because if they can't isolate properly, it spreads there, and you end up with more illness and obviously more hospitalizations and likely fatalities. But we also understood as time went on that if someone tests positive in a long-term care facility, if they can't isolate, if the person's medically stable, doesn't require hospitalization, keeping them there does run the risk of spread. And so over the course of the last probably about 6 to 8 weeks, Secretary Mayhew has identified a number of COVID-only facilities. So if you have a medically stable nursing home resident who's COVID positive, you have a safe place to transfer them that can handle COVID patients short of hospitalization. And I think that that's a smart thing to do, and I appreciate her helping to get that done. If you look, these are the daily positive test results from long-term care facilities. So it's not just the residents, it's also the staff. You have this whole community is between 300 and 400,000 people. So in Florida, that's a lot, over 4,000 facilities. And if you look, you have seen, I think, noticeably a little bit of a decline over the last 2 weeks in terms of the volumes of cases that had been coming in. And that's very, very important because if you have a nursing home outbreak, those are the most likely outbreaks to result in clinical consequences. So we're hoping that having gone through, and part of the reason I think you had more positives in like that April period is because the most vulnerable and at-risk facilities were the ones that were identified for testing. So the ones that had this spick and span infection record, they were kind of doing their own thing. The ones that had a little bit of trouble in the past, those were the ones that were identified, and I think that's why you ended up seeing more cases in those early days. So what are the clinical impacts due to COVID-19 in Florida right now? Obviously, you're looking at ICU hospitalizations, very important indicators. So this is a 60-day spread. So state of Florida, statewide, down 43% in terms of COVID patients who are hospitalized in the ICU. And 30-day or 60-day spread for ventilators, down 56% statewide. 60 days ago, we're at 547, now around the 240 mark. And so those are, you identify a case, if the person's 25 and has no symptoms, or if the person's works on a farm somewhere and has no symptoms, they're not the people who are likely to end up in the ICU or on a ventilator. If you have a nursing home outbreak, well then, some of those folks are more likely to be in that critical care situation, and that's something that's very, very significant. You look at the fatalities by date in the state of Florida. We had really from that second week of April through early May was kind of the peak period, and it has trended downward since then. I think that's similar to what you're seeing throughout the rest of the country and other states as well. An interesting way to look at this, though, is to separate the fatalities between those who have been in long-term care facilities, and that's not just you died in a long-term care facility. Anyone who's a resident or staff member has a COVID-related fatality counts in Florida as a long-term care facility death. If you look, the colored area is all the Floridians, the 21.5 or 21.8 million who are not residents of long-term care facilities, and then the white represents those who are residents of long-term or staff of long-term. I'm not sure that we've had staff fatalities yet, but obviously we've had a number of residents. And you look and you see really from that second week of April, you have seen a pretty steady decline in the general public in terms of COVID-linked fatalities. And the bulk of the COVID-linked fatalities have been, certainly since the beginning of May, overwhelmingly have been in the long-term care facilities. And so that's why it's really important when you're doing testing to having them test routinely. When we did all that we did over the last two months, when you have places where COVID-positive patients can be transferred so they're not infecting other people, that's the reason why, is because you're talking about folks who are 80, 85, 90. I mean, we have probably 20, 25 deaths over 100 that are COVID-linked. And in Florida, there's more deaths over the age of 85 combined COVID-related than under 65. So it's a really significant thing. But from the general public's perspective, to understand, the risk, I think is very important, and that's a trend line that they can look at. And then this is just the trend line with taking all the long-term care facility fatalities out, COVID-linked. That's what the trend line looks if you're talking about the general public in the state of Florida. So who's contracting it? So this is a big change. If you look back in the beginning of March, the median age of every positive case was 65.5. And with a virus that, as we know, is more difficult for people who are advanced in years, that is something that is problematic to have seen. Now, obviously, you're talking about a relatively limited number of cases at that time, but then as you've gone, you notice how the testing, we started to ramp up testing. You're doing 7,000 tests a day, maybe 10. So it's kind of the median age is like 50, 51, 52, all the way into May. And then what happens is, as the testing is really ramped up, look how that median age has really gone down for all the new cases. So last week, you had a lot of cases. The median age was 37, so half of those cases were people under the age of 37. And I think that's one of the trends that you're seeing is that 25 to 35, way more positive tests out of that group than you would have had 2 months ago. Part of the reason is a lot of the people in that group 2 months ago, unless their doctor wrote them a note, they may not have been able to get a test, particularly if they didn't have any identifiable symptoms. Well, now they're in situations where their employer can say, hey, go get tested before you come to work, and then they can go regardless of symptoms. And so I think you're starting to see more of the 25 to 35 cohort identified. I think very few of them have symptoms. And in some ways, it really helps stop the spread, because if you didn't have that testing available, someone would be going on their way thinking everything's fine. Now, if you test positive and you properly isolate, then you're not going to be infecting other people. But that is really, really significant, because when you have a virus that is so stratified by age in terms of its negative consequences, the lower that number is, really the fewer clinical consequences you're going to see as a result of this. And this just flows from this in terms of, in Florida, in terms of the COVID fatalities. And we haven't had a fatality under the age of 18. Very few throughout the country have been linked under the age of 18. And I think almost all of them had really serious conditions. We're now up to 86% of all Florida COVID-related fatalities are age 65 and above. And there's more, and this has been consistent for the past month or so, more Florida COVID-related fatalities over the age of 90 than under the age of 65. And so, that's the cohort that really is significant in terms of the protections. And so one of the things that we're going to continue to do is to focus on the long-term care facilities. I know folks in the community have asked, when can you have visitation again? And I want to be able to do that, but we obviously want to be very safe about it, because that's a high-risk environment. Having the periodic testing of the staff is going to be very, very good. It's one thing to test everybody once, which is good, and we needed to do it. We did identify a lot of cases. And incidentally, some of those seniors are asymptomatic. You'd think that if anyone in a nursing home got it, that they would immediately fall very ill, and obviously some of them do. It's a serious thing. But it was surprising how many had very modest or even no symptoms, even at that age. But it's very, very important. And if you have people in without the proper protections, then you could spark an outbreak, and that is going to obviously have a lot of health consequences. So I want to be very careful about that. But to have the periodic testing, every 2 weeks, that is more surveillance-style testing. You test once and you're negative, that's great, but you can get it 2 weeks later. And so to constantly go back with the staff, which will be the entry point for this, is something that's very, very significant. So we're going to continue to do that. And then we're going to continue to advise our senior population, 65 and older, to avoid crowds and limit contact as much as you can with folks, particularly a lot of the younger folks who may be silent carriers to this. I think the seniors in Florida have done a fantastic job, really from the beginning of March, heeding the calls to social distance. And that's really, I think, the most important thing when you're dealing with the vulnerable population, and then how that contact would be with populations that may not be as vulnerable, but may be carrying the illness. So we're going to continue doing a lot of testing. I think we probably, we're over 30,000 test results a day now. We may end up seeing even more of an increase. We probably are pretty close to one of the tops in the nation in terms of the numbers we're doing every day. And then going into certain areas where you have very risky working conditions, particularly in these farm camps or with some of these construction workers. Some of these guys, they go to work in a school bus, and they're all just like packed there like sardines going across like Palm Beach County or some of these other places, and just all these opportunities to have transmission. And so it's something that we're going to continue to keep an eye on. Now, some of these workers are migratory, so they're going to be going some of them already left this weekend to go to other states. Florida's Department of Health is in contact with Georgia, Alabama, some of these other states to be able to work with them and give them a heads up about what might be coming down the pike. And with that, yes, sir.
About the budget, and that is, do you feel like the vetoes that you're thinking about will be sufficient to hold the state over until the legislature comes back in November, or do you think the legislature is going to need to come back?
No. I think it'll be sufficient for sure. It's gonna, but there's going to be a lot more vetoes. It'll be a lot of red. It's kind of the veto equivalent of the red wedding from Game of Thrones. It's there's going to be things that are in my budget that I'm definitely going to veto, just because the fiscal picture is different. I think we probably are going to hopefully recover quicker than maybe we thought 2 months ago. But between the vetoes, and I'm going to hold back some agency spending, and then we do have identified some CARES Act money which will be able to be used. I have no worry about us getting to the election. Teacher raises are important. I said I am going to veto some things in my budget. I'm not going to veto everything in my budget, so we want to obviously try to deliver as many of the priorities as we can, but it's just a situation where I created a budget under certain assumptions and conditions. The legislature did a budget under certain assumptions and conditions. And even though the pandemic was here, once they laid the budget on the desk, there was a radical change between that second week of March later. It's like shut everything down. So I don't think the legislature should have foreseen, because I think it was a very abrupt thing to have happen. And so I think that they did a good job, and there's a lot of things in there that I think are meritorious, but at the same time, we're living in a different reality. We've got to take that into account, and so we will exercise that authority accordingly.
Governor, it sounds like from your presentation, you're attributing the uptick in numbers that we're seeing to more testing or specialized testing in certain cases. Is that right? Are we not seeing community spread?
There's been community spread the whole time. Obviously that's the case. We identified community spread in March, early March. So that's obviously the case. When you have drive-through testing sites, those are cases that are coming from the community. But I think the raw numbers, obviously, if we were testing 10,000 a day, you would have less raw numbers. There's just no doubt about it. Part of it is being very proactive with the testing. When you're going into these places, these are not necessarily people who are begging to be tested. These are people that are health officials, people, the Department of Health, others, going into these places and then testing everybody. So that is definitely important. And then there are some pockets in different parts of the state where, and some of these are the test sites that we have that are identifying, particularly in some of the low-income areas where you see a higher rate of positivity. I think that's also the case as well. But when you have 90 out of 100 test positive, what that does to a positivity, that's huge numbers, because in a drive-through test site that we have, I don't even think you'd get 90 for a week in most of our sites, with hundreds and hundreds of people going by, because those test results in most of those counties, those are like 2% are testing positive there. And I think with the migrant and the jail, obviously, I don't know that they're interacting with the broader public as much. Obviously, nursing homes are there, but I do think some of the folks who are in similar housing situations in different parts of the state where you've seen more numbers, I think a lot of it is attributed to the congregate-style housing, having multi-generational. We still have high positivity in Hialeah. Hialeah has been high positive for probably 2 months now. So you go there, and I think that's attributed to kind of how they're going. So you do see that throughout parts of the state for sure, but I think when you have major 50, 60, 70% test positive out of 100, 200 people, that's a big deal. That was something that we were not necessarily seeing 3 or 4 weeks ago.
There's talk that maybe with this community spread, there might be time to talk about maybe rolling back some of the reopening process, bringing back down the number of people allowed in restaurants, even trying to somehow mandate wearing masks like in Dade and Broward. Do you see any of that in the future? Is that a possibility on the horizon? communities and whatnot.
Well, no, I mean, like I said, I mean, we've had community transmission the whole time in different areas. It's not like we didn't have that. I mean, you've had it in Dade, Broward, Palm Beach. You have pockets in Hillsborough that are identifiable if you look at the positivity there, some other places. So that's always been the case. But in terms of like, the restaurants have been doing this for, what have they been doing it for 6 weeks? I mean, the idea that all of a sudden is the reason, I'm not sure that's the case. So no, we're not shutting down. We're going to go forward. We're going to continue to protect the most vulnerable. We're going to continue to advise, particularly our elderly population, to maintain social distancing, avoid crowds. The mask, we've basically said from the beginning, if you can't social distance or if you're in a face-to-face, then the masks are recommended. But I see, you don't need to be wearing it if you're going for a jog or you're on the beach. And so some of this stuff can get out of hand. I want to be more reasonable about it. Sir.
At what point would you consider maybe rolling back some of those protections?
We're not rolling back. Like no. You look at what's going on in terms of, I showed you the ICU. I showed you the we've got 6,400 ventilators that are just sitting idle, even with having, and remember, the reason we did the mitigation was to protect the hospital system because you didn't want hospitals overflowing. There was a lot of predictions about how many COVID patients would be in the hospitals. We've never had more than, of all our beds, probably more than 3.5% have been COVID. I mean, we've got, at the beginning, before the pandemic started, the hospital capacity, we'd have about 10 to 12% of the beds have been available. Then in the middle of the pandemic, kind of at the height in April, you had 40% of the beds were available. So then we get into May and we tell the hospitals, you got room, do your elective surgeries. So you have people now allowed to go in and do whatever they want in the hospital. And we've been between 25 and 30% vacant this whole time. And so that is really why we did why they did the shutdown. And I think the negative effects of that would far exceed any gains you're getting. Would shutting down the state stop some of the examples that I showed? I don't think so. And so you have to have society function. You have to be able to have a cohesive society. That's the best way to be able to deal with the impacts of the virus, but particularly when you have a virus that disproportionately impacts one segment of society. To suppress a lot of working age people at this point, I don't think would likely be very effective. Yes, sir.
Doctors, Governor, visit you at the governor's mansion this morning. You probably weren't probably here, but they made the argument that wearing a mask is better than wearing a ventilator, their exact quote. And I wonder what you make of that as you look at the average age cohort that are getting infected go down from 65 to 37. Does that indicate that potentially there might be a need for more PPE requirements at mass gatherings, be them people gathering on the beach or folks gathering for restaurants?
So I don't think, what the CDC said is if you can't social distance or if you're in like a face-to-face business. So, for example, I was down at the NASCAR race in Homestead. I waved the flag to go. And we ate lunch before we went. And all the servers had masks and gloves on. And I think that's the way to do it. That's safe. I never felt like I was going to be in a situation where there was going to be a problem with any of that, and that's the way to do it. Now, when you start talking about being on a beach, I just don't think that's a reasonable thing, certainly under penalty of law, to do. And despite all of this, I mean, as much as the beach has been, people have talked about it, I mean, you haven't seen cases linked to being on the beach. It'll be interesting to see with these protests. I actually have been relatively negative about seeing a lot of cases out of it, because my view is when you're outdoors like that, I think it's probably less likely that this thing spreads very much. At the same time, I mean, you have seen massive gatherings throughout the country, and so we'll just have to see. I mean, now it's been going on a little bit more than, it's been 2-3 weeks now, so you may start to see some stuff there. But, I would definitely encourage people when you're in, whether it's a business situation like in a restaurant, if you're going to a place where you can't social distance, to do it. But in terms of forcing that under penalty of criminal law, we're not going to be doing that. I think it would be applied unevenly, and I just don't think it would end up working. At the end of the day, we should be trusting people to make good decisions. Floridians have shown they can do that thus far, and I think that they'll continue to do it in the future.
Governor, health officials in Palm Beach County today said that they are seeing an increase in COVID Part of flattening the curve was bringing down hospitalization rates so you didn't max out hospitals. Is it okay?
Well, we're not even close to being maxed out. I mean, so that's not.
If you're seeing more hospitalizations.
Well, obviously you don't want to, but what happens is you'll have certain areas where we'll have to clear out a nursing home. And I'm not saying that's the reason with Palm Beach. I know in the past we have had to do that. So there's times where you'll send 50 people to the hospital who are in a nursing home. And I know Palm Beach, they're having a problem with some of the farm communities in the interior of the county. So some of those hospitals out there have seen more people, and part of it is because of some of the things that I've talked about there. But at the same time, statewide, this has been something that's been incredibly stable, incredibly low levels given how many hospital beds that we have available. And so yeah, it's something that you should be concerned about. But the idea that somehow we've reached capacity, I mean, that's just totally not true statewide.
That restaurants across the state are closing for a few weeks because employees are getting infected, and people are asking, should masks be mandated everywhere?
So the restaurants are making decisions to keep their people safe, and I think that's great. I'm not familiar with every example of that. I mean, I have heard anecdotally some stuff, but they obviously want to create a positive environment for their folks, and so they're going to do it. And if they want to do the mask, then they should definitely do it. There's some places. When we were down in South Florida, they had the requirement. If you're going to come into the place, you got to wear a mask. Not every place has that. Obviously, when you're talking about food, it's a little bit different. But that's something that I think those businesses can make those decisions on. So.
Two questions, if I could. Would you recommend people wear masks in close quarters at the RNC? And then second, in regards to the budget, you mentioned holding back agency spending. What's that going to look like? Hiring freezes? What are we talking about?
Well, I think it'll be a requirement on every quarter to withhold a certain amount from their total spend. I think we've calculated that could be pretty significant amount of money in terms of what you're looking at. So we think we can do that, and we've also taken some steps once this hit to be able to save some of the revenues that we have and to make sure that we're being fiscally prudent. I mean, for example. As much as I like doing it, we have the Job Growth Grant Fund. I had 20-some million, 25 million, I don't know what we had left, that we were planning on over the course of March, April, May, June, being able to do infrastructure. We're going to do some job training stuff. I'm not going to be awarding any of that. We're going to leave the money to go back in the kitty and make sure that we have more general revenue. So those are just things that you have to do, but you can actually save a lot of money by just withholding a small percentage. It's not necessarily going to be anything with employee pay, but there's different things that agencies spend on, and as you get to the end of fiscal year, sometimes they just start spending on different things, and so if you're prudent about it, I think that there's ways that you can do that will make an impact. But we're going to be outlining all that very soon in terms of the budget, over the next 2 weeks, and so I know you guys will want to be there for that, and so we'll see you then.